At least for now, coronavirus testing is still up to cities and states, and in much of the country, there's still a lot of work to be done. So some cities are starting to take on the challenge on a smaller scale, like Somerville, which just launched a new drive-through testing operation, promising to test any resident, regardless of insurance or immigration status. The city also now requires anyone in public places to wear a face mask, with fines potentially up to $300 for violators. I'm joined now by Somerville Mayor Joe Curtatone. Mayor, it's good to see you. Thanks for being here.
Thanks, Jim. Good to be on the show.
So on March 6th in Atlanta, the president said anybody who wants to have a test can have one. 8 weeks later, we know that's not true. You made the same commitment yesterday, and I just want to be clear, even if you're asymptomatic and you request a test in Somerville, you can get one?
Right. You can get a test if you don't have insurance, notwithstanding your status, or you're asymptomatic. All you have to do is call the hotline number with Cambridge Health Alliance and schedule an appointment.
We're going to put the hotline number on the screen, 617-665-2928. Could you do the math for me, though? I read in the paper that you had 3,500 test kits. I spent a little bit of time in Somerville myself. I live right across the border. You have like 85,000 people there. How do you square 3,500 tests with 85,000 people?
Well, we're still really we're still dependent on supplies coming in. This started several weeks ago, 5 weeks ago to be exact, when we started one of the first mobile sites at the Somerville Hospital campus only for Cambridge Alliance patients, with the goal of making it available citywide. Now with the 3,500 extra kits, that allows us to expand this citywide to about 130, 150 tests per day. We want to get to 500. What's holding us back for even going at a greater rate or faster rate is, again, the lack of supply, reagents, swabs, vials. So we're going to continue to fight to get those materials so we can expand that rate. So we can't do 80,000 in one day, but we're starting to test people outside of the CHA who are not CHA patients, who are asymptomatic as well. And that's the only way we're going to get our hands around this virus is if we do testing, and more testing.
And you're convinced you'll be able to you'll ultimately have enough test kits to honor your commitment to all the people of Somerville who want it?
That's the plan. They cut supply from us. They cut it off for everyone. We're going to continue to fight to get that supply, and we feel confident moving forward.
Let's move on to masks. My understanding is until you made your announcement yesterday, you, like the mayor of Boston and the governor of Massachusetts, were urging people to wear masks but not mandating it. Why'd you make the change yesterday?
Well, first, I want to thank the public. We've had incredible compliance around the host of regulations and mandates we put out. Still, we see a lot of evidence of people not wearing masks or facial coverings. And we know that when we breathe, we cough, we sneeze, we release moisture particles in the air. Other people breathe it in. That's how this disease gets transmitted. And we want to interrupt the transmission of the virus from person to person. So wearing a facial covering can help achieve that. It's abrupt. I know it's not comfortable for people, but it's necessary. Nobody wants to get their neighbor, the grocery store clerk, the postman ill. And so we all need to do a little bit extra at this time.
And by the way, when you use the term compassionate policing, I think it was yesterday, does that mean, I assume, that this $300 fine is an absolute last resort? A cop is going to try to convince someone to put on a mask, not slap them with a fine.
Absolutely. Look, we're going to spend a week in terms of a grace period to educate people, remind people. And if you're doing your best, and if you have a toddler, I understand I have 4 boys, they're teenagers now, but I get it. It's hard to keep a mask on them. Or maybe you have some other underlying condition or a mental health issue. But if you're physically able, but you're just willfully not compliant, you'll be subject to the fine. But we're going to work with people. We don't want to get to that point. We're just asking people to do a little bit more at this time.
Couple of mask-related things. I think people know that this Battelle company from Ohio that is decontaminating ultimately as many as 80,000 N95 masks a day, a godsend, obviously, for healthcare workers, is situated in your city at Assembly Square. How is that going so far, Mayor Curtatone?
It's going great. So the Battelle critical care decontamination system can clean and sanitize up to 80,000 of those N95 respirators per day, and they're ramping up to that number. It's going great. Last check last week, we had about 100 hospitals from around New England. We've also connected them with other municipalities to get their N95 masks for their first responders, their assisted living facilities, and other critical workers, sanitize and clean. And it's doing a lot to add capacity within the healthcare system at a time where personal protective equipment, masks, gowns, and the like, have been at a shortage.
I want your observation on one more mask thing that just totally left me speechless. Here's the Vice President of the United States touring the Mayo Clinic. As you notice, he's the only person in the room without a mask. And the Mayo Clinic said in a Twitter post it had informed the Vice President of its policy mandating masks before he toured the facility. What's your reaction to that, Mayor?
It's frustrating. It is brazen and really reckless, I submit. We need to set an example for the public. We need to be ethical in the words we use and honest with them about what is happening out there, that people are dying, people are getting sick, and we have a long way to go. But we also have to set an example of how we should be acting. That's why I wear my mask when I go out in public, and I always will. My family will. If we expect people to act at a certain standard, then we have to really display that behavior. So it's something.
Your fellow mayor, Marty Walsh, was on our radio show the other day and was giving you credit as the inspiration for allowing restaurants to become sort of mini grocery stores, which, as you know, he announced a couple of days ago. Do you have any other, I'm serious, creative ideas in the pipeline to help struggling businesses stay afloat in non-traditional ways?
Well, we're getting these ideas from our constituents and other communities. I'm flattered Mayor Walsh gave me the compliment, but honestly, we all work together. Municipalities are talking with one another. We're talking about the challenges we're facing, the challenges our people are facing, our small businesses. That was one idea that came up actually from our business community to help keep the lights on, employ some people, assist with food distribution and supply chains, and provide another point of food access for people. So we're exploring and continue to explore how we can support those small businesses so that when we get to the other side of this epidemic, they're ready to be up and running and get going again. And yeah, we're exchanging ideas with Mayor Walsh and other leaders across the Commonwealth and the country. And I'm grateful for his leadership as well.
You forgot to mention you get a roll of toilet paper, too, at that restaurant. If it's available.
That's right.
Before you go, early on in this pandemic, you were somewhat critical of the governor, calling him too cautious, too slow to act, particularly around school closings. Do you have a different view now, weeks into this thing, of the governor's performance?
I think the governor's doing a good job. I know they're doing their best, and we all have the same goals. We want to uphold the stability of our healthcare system. We want to make sure we avoid the worst case scenario. We want to come out on the other side of this thing where we can reopen our economy in a sensible and smart way, guided by science and the experts. My criticism at the beginning is that in a crisis, we need to be deliberate. We need to be flexible. We need to act quick. Days matter at the beginning, and I'm grateful that state finally came along to close schools when they did and eventually close for the rest of the year. Now, coming out of this epidemic, it's critical we do not rush in our next step. We need to be smart. We need to be guided by the experts and the science, because if we don't do things in that particular way, if we're guided by some other interest, then we risk that the resurgence will be worse than the first part. More people will die, and our economy will, if you can imagine, go into an even deeper abyss than it is now.
Mayor,
that takes commandeering, collaboration, and communication, and I'm grateful that's happening better now.
Only 10 seconds left. How would you rate the president's performance?
I don't think there's anything below an F. We need leadership. Not really. We don't need sideshows at this point. This is a serious situation.
Mayor Curtatone, it's good to see you. Thanks so much. Take care of yourself.